So we are yet back to our landing page, which is the AKU library web page. I would like us to go through our resource of the week this week, and this was shared in our emails. I hope we all received that email about a resource of the week. It was, who can remind me what the resource of the week was? Now, you're most welcome.
Thank you. Good evening to everyone.
Good evening. How are you doing?
I'm very fine. Under God is my arm protection.
That's great. I'm grateful to hear that.
Yeah, that's it. God is taking care. Thank you so much for the service of AKU student.
You're most welcome. So, colleagues, I see someone named the iPhone. I can't know who they are. iPhone, kindly put your right name. Okay. For those of you who don't know, Naula is a veteran of the library, and I'm glad you've made it today. Guys, allow me to continue. Can you see my screen?
There is nothing
on the screen.
It's
Let me share again. How about now?
It's shared. You know, we see.
That's good. So we had an eResource of the week this week, and if I remember correctly, it was to do with ClinicalKey. Do we remember that it was ClinicalKey? Did we all receive our emails showing the same information?
Yes, I.
Okay. So I am going to open that web page. I could use the email itself. Let me try to go to the email and open that resource ClinicalKey. If you're on your machine, you can also do the same if you received. I will also be able to share with all of us the link to the resource so that we can all test it together. So I'm going to go to that website, ClinicalKey. As it is opening on my end, you can also be testing it on your end. Are we together? I hope you can see it. When you can see it, so I'm sharing the link here in the chat. For those who are on, please, you can click on it. Hey, Nachans, you are most welcome. I think, okay, Justin, you're on. Okay, I think I've welcomed everyone else. iPhone, please, when you get time, edit. So this is ClinicalKey. ClinicalKey is a resource that we have access to, and it provides us access to nursing content, which includes some textbooks, some journals, some point of care monographs, customizable patient education handouts. It also has drug monographs. It has videos. It has images. Also, it has practice guidelines and clinical trials. It is provided to us by a provider called Elsevier. It's one of the Elsevier resources that we have. And when you look at the interface here, you can still see Elsevier here, which shows you that it is part of Elsevier, but the package is called ClinicalKey. Now, when you reach this resource, okay, let's say you're on campus, you'll be able to use it directly because you'll be recognized by IP. However, if you are home, we are going to rely on our usual authentication method, which is Open Athens. What would you do? You go to where you see the word login. Don't click on register, just click where you see the word login. It will bring to you this interface. So it will bring you to this interface, which has the Aga Khan University Hospital, Nairobi, or in abbreviation CK Student Nursing, Premier Instructor Access, and then Aga Khan University Group. Please disregard the second one, use the first one. You can also tick this such that it remembers and never asks you again. So once you pick this, you proceed and click on the word continue. Okay, for me, I've been logged in automatically. I was expecting Open Athens to bring me that window. There is a window that appears to ask you to log in. Is there anyone practicing on your end? If you have seen it, that window for Open Athens where you put in the email and password of Aga Khan, your Aga Khan credentials, has anyone seen it? Do you have anyone practicing as I proceed? So let me try to sign out here and see what happens.
I'm trying.
You try and let me know what you see. I'm also going to log out here. I think they logged in. Good evening, Justin. Yeah, let me try to log out so that we can all follow while we are together. So I don't, well, you don't know where we are. Okay, Justin, Nancy, sorry. We are on this resource called ClinicalKey, which was the resource of the week, which we shared. The link to that resource is here. I've pasted it again in the chat for you. Now that link connects is the one that allows us to reach this resource. So you simply click that link and you reach here. Now I was saying that when you're on campus, you can use this resource without needing to log in because by IP, they will recognize you. However, when you are away from campus, you'll be required to log in. So our login is going to rely on our Open Athens authentication method. So in order to reach that method, you go at the top here on your right. You see where there is English, there is CME stroke MOC, then store, login. Don't click on register, click on log in. Log in. Click on it.
Something is covered.
Something is what?
I think something is covering what it's not.
How about
Something
now?
it's there.
Now it's okay.
There is a long rectangle.
So that you can't see very well. Let me reshare.
It's now down.
It is that window which has the words to share. Yeah, sometimes it behaves that way. Are we together now?
It's appearing. We are.
It is still appearing.
Extreme corner, but now we can see what you're sharing.
Yeah, okay. How about
That's
now?
better. This is better.
Okay, so you can see where the word Open Athens
It's
login.
Back. It's
back.
back. Okay, yes, we can see the login. This is okay.
You can see the login interface. Please do not put anything yet. You look at where the word log in via your institution. Are you seeing it?
Yes.
click on, this is what we are supposed to click on. When you click on it, it is going to open for you the Open Athens interface, and then you will be able to log in. The other time for me to log in automatically because my credentials were automatically picked, but it is supposed to appear like this. Gives you this interface, you put in your email, I'll put in mine. That's mine. Then I put in my password. You can also do the same on your end, and you'll be able to log in using our authentication method called Open Athens. Are we together? I hope nothing is covering now.
Yes, we are.
Then you pick Aga Khan University, Uganda. It is here. This time it has brought them well. Then if you wanted to remember that without asking you again, you can say, remember this organization, and then you are automatically signed in with even your name appearing in the top right side. You can see my name is here. I can open here and see what I have. I can make some settings. I can do the CME stroke MOC. I can change language. I can see what I have saved. I can look at presentations. I can change organization. I can configure remote access. Okay, those are the things that I can do with my my settings, but that is not so important for now. The most important thing is this interface where you can search from. So at the search window here, you can see there is the word all types. So if you want to search through all these materials, you leave it on all types. But if you want to search specific package, for example, on the books, on the journals, or on the clinical overviews, or clinical trials, or drug monographs, or guidelines, or patient education, or multimedia materials, procedure videos, clinical calculators, and more. You just pick it and then you search. Also, below that search in area, there is Ask ClinicalKey AI. This is an AI feature that is provided by ClinicalKey that you can ask things to do with the ClinicalKey, and then it will be able to respond to you. I have not tested it before. Actually, I can just click here. We see what it does. I hope my screen is not covered.
Right.
Someone was helping respond. It is okay.
It's okay.
So this is an AI. Okay, they are telling us to log in again. Log in to ask questions. Okay. Should I log in? Let me test. This is something I've not used before. So I'm trying to test how it works. Let me see. You might be having access and I don't know. Now it is asking me for my Elsevier username. So this one will not work because we don't have this. And there's no option for Open Athens. So I want us to go back here and look at the bottom below that search window. There is inform your clinical decisions. Number one, clinical overviews. It has a comprehensive clinical topics. It can give you comprehensive clinical topic summaries. Patient education, educate and empower your patients. Drug monographs, drug and dosing information to guide treatment. Calculators, interactive tools to support clinical decisions. And then guidelines, which now have the latest clinical guidelines from leading organizations. So that is the information that we have so far. So when you want something, you can either click here on this and go switch to it, or you can search from here. You can actually search specific package, for example, books, books, journals, overviews, and others. You can also alternatively see your search history here, or saved articles, or saved searches. So I'm going to look at clinical overviews. When you click on it, it will bring you those overviews from A, or even actually if it has a number from the number to letter Z. So they are arranged alphabetically. We can see abdominal, aortic aneurysm, abdominal aortic aneurysm, which is a condition. So if you want to read more, and it was updated on 30th December 2024. This was updated on 1st January, this one on 21st December. So they keep updating this information here. So what would you do? If you want to have an overview, clinical overview of our abdominal aortic aneurysm, you simply click on it, and more information to explain it will appear for you. So let's wait. So this is what it is. Abdominal aortic aneurysm, the synopsis is urgent action. There must be no delay in admitting patients for emergent operative repair when symptoms associated with impending rupture occur. So key points are this abdominal aortic aneurysm. It is focal dilation, diameter greater than 3 centimeters of the abdominal aortic artery, involving all layers of the wall. Modifiable risk factors include smoking, hypertension, elevated cholesterol level, obesity, and pre-existing atherosclerotic occlusive disease, and others here, which you know this is in this field of yours. Pitfalls: do not rely on clinical examination to exclude abdominal aortic aneurysm, and also avoid delay in referral of symptomatic patients for emergency vascular surgery evaluation. So that is information they are giving us. I know that this is something that makes sense to you. So it's a clinical overview for you. Terminologies are here. You can click clinical classification. They will give you clinical classifications. Abdominal aortic aneurysm is focal. Okay, I think we finished this. Then classification is by location, by infrarenal aneurysm originates below the renal arteries. Juxtarenal aneurysm originates at the level of the renal arteries. So more information is here for you to read and make make informed decisions when you're working with your patients. Then about that was a clinical overview. We could go back and look at something else, which is not a clinical overview. See what we have. Drug monographs are here. So if I click on that, I'll also be able to see or have a look at the monograph. So we have Abacavir. I think these are medications. I don't know if the Panadol is there. I'm just going to try and search. But yes, it's about the drugs. Oh, sorry. It's going to search. I hope it will see it. I think Panadol is not there. Among the drugs that we have in here, it's not there. But there are drugs that work like Panadol that are in here. And remember, this information is also arranged from A to Z. So let's check what this drug is, Abacavir. Just a moment. It's a nucleoside reverse transcriptase inhibitor, NRTI, approved for use in combination with other antiretroviral medications to treat human immunodeficiency virus, which is HIV, infections in adult and pediatric patients aged 3 months and older. The FDA-approved package labeling contains a black box warning for serious and potentially fatal hypersensitivity reactions to Abacavir, particularly in patients with the HLA-B 5701 allele. Ensure all potential drug recipients are screened for that particular that particular thing prior to starting therapy. If a hypersensitive reaction develops during treatment, immediately and permanently discontinue use of abacavir. Recharge is contraindicated. So this is a description of what that drug is, how you can serve it to your patients, and under which conditions. So the information is here. Okay, that is our drug monograph. Apart from the drug monograph, we have we also happen to have just a moment, I'm trying to go back. We happen to have not drug monographs again. Let me just click here to take me to home. So we have calculators. Eh? In your term, the calculators, actually, let me open these ones in separate tabs so that we can easily look at them. So our calculators are opening, the guidelines are opening, and then the patient handouts are also opening. This is more information that you have that you can give to your patients. Then, when you want to deepen your specialty and medical knowledge, you can look at the books that we have in here. I'm going to open. Then we also have journals. So I'm just opening. We have journals. So here we have the drug calculators. Here, I don't know what to put. You can guide me for those of you who work with drugs. And they're also by category. There's the biometrics, there is the cardiology, critical care, metabolic, pediatrics, pulmonary. So they're like that. So those are the categories of the calculators, and they are here. The anion gap delta, osmolarity estimator, like that, osmolar clearance. Okay. Then we have guidelines. They are also arranged alphabetically from A to Z. There's one guideline for treating allergic rhinitis and allergic asthma caused by house dust mites. That is under A. Let me try to go to P, see what is there. There's a note from someone. The screen is not clear. It's not, eh? What today, that date, yeah. Let me see. Let me see. If it improves, alert me. Eh? How is it now? I need feedback. Eh? How is it now?
Okay, now.
So I clicked on letter P so that we see some of the guidelines. So we have guidelines on pacemakers and MRI. It's a protocol in line with international guidelines and approved by the SFICV, which is the French Society of Cardiovascular Imaging. Let's open it and see what we have. It's a guideline. Eh? It is here. The rate of pacemaker implantation is increasing each year. It has been estimated that about 1 person in 1,000 in the Western world has received a pacemaker before. Okay? And despite major advances in pacemaker technology, notably with the advent of magnetic resonance imaging, which is MR compatible pacemakers, it should be borne in mind that these medical devices still contain ferromagnetic material and remain a relative contraindication for MRI. Nonetheless, when the risk-benefit ratio is favorable, imaging may be performed under specific safety conditions. So here, those are procedures. So I told you the procedures are also arranged alphabetically from A to Z. You can go through them. You can pick any letter depending on the one you want, or you can search here where you see filter list by title. So this is also an available resource for you through ClinicalKey. There are two clinical keys. There's clinical key nursing, which is what we are on. There's also clinical key student nurse. That one is different from this one. Now we are looking at just clinical key, okay? What else does it contain? It has patient education. So these are tips. The first tip here, the 14 tips for parents using OTC medicines for your children. Then there is the, some of these words are really, really strong. There's abdominal aortic aneurysm tips. So let me open the 14 tips and we see what we have. They are here. Always read and follow the medicine label. Check the dosing directions to make sure the medicine is right for your child's age. Always give the recommended dose. Don't give a medicine intended for adults to your child. Never use the cough, cold, or allergic medicines to make your child sleepy. Be careful not to double dose by giving your child two medicines that contain any of the same active ingredients. Just a moment. Nabosa, be patient. I'm coming back. So I'm back. We're still here on the 14 tips. So these are tips for you. Be careful not to double dose. Never give an aspirin containing products to your child and adolescent for cold or flu symptoms. If your child develops any side effects or reactions that concern you, stop giving the OTC medicine and contact the healthcare provider immediately. Talk to your healthcare provider if you have any questions. So these are tips for parents using OTC medicine for your children. Let's look at other tips. Just as a sample, abdominal amnio infusion tip. Okay, I don't know whether these are tips, but yes, let's look at it. An abdominal amnio infusion is a procedure that's done during pregnancy to replace the fluid around your baby in the uterus. This fluid is called amniotic fluid. What are the risks? Your health care provider will talk to you about that. But the risks, one of them is infection. You can get to bleed. There can be bleeding. There can be allergies to medicines. It can do damage to other structures or organs of your body. There could be cramping and also the possibility of early labor. So this is information that you can read and also explain to your patients before you serve them so that you guide them well. What happens before the procedure? The medicines are there. Ask about changing or stopping any medicines you take, any vitamins, herbs, or supplements you take. Do not take aspirin or ibuprofen unless you are told to. General instructions. For your safety, you may need to wash your skin with a soap that kills germs. Get antibiotics. Okay, so this is information that you need to know when this procedure is being done or before it is done. And this was updated actually yesterday. Yesterday was 2nd October 2025. It is here. This is when it was updated. So this information is updated regularly, extremely regularly. So for those of us who are working with procedures, patient education, ClinicalKey can help with that. Please remember, to endeavor to use it. It's a resource which is available for us. Then ClinicalKey also provides us with the books. So the books are also arranged from A to Z. So the books are here. There is information on 3D printing applications in medicine and surgery, abdominal imaging. So the featured books are on the left here. So these are like chapters in those particular books. So we have 2 books, pediatric hematology and oncology, and then current surgical therapy, 14th edition of that book. Let me try to open it so we see what is available. So this is all in that particular book. All these, it's like an index of information that you can use here. So let me click like to non-toxic goiter, see what happens as a sample. Non-toxic goiter, welcome to our new ebook experience. I will not go to that. Goiter is a non-specific term referring to any enlargement of the thyroid gland. However, in common use, it mainly denotes benign causes of thyroid enlargement, such as toxic multinodular goiter, diffuse toxic goiter, Graves' disease in brackets, or non-toxic multinodular goiter. Though malignant enlargement of the thyroid gland can technically be considered a goiter, it is usually referred to as a mass or nodule. Toxic goiter is a benign condition, even though some specimens may contain smaller incidental cancers. Up to 20% contain microcarcinoma mass. The predominant decision-making process is based on the benign enlargement and resulting symptoms. For example, dysphagia, dyspnea, or neck pressure. In some areas of the world, non-toxic goiters are endemic due to iodine deficiency, though public health efforts have reduced this somewhat. The pathogens are here. Non-toxic multinodular goiter is defined as an enlargement of the thyroid gland. I think we've gone through this. Clinical features. Non-toxic goiters may remain asymptomatic, or they may give rise to compressive features such as dyspnea, dysphagia, or venous congestion, discomfort with certain movements. So this is all you can see. So I think the pictures are here. How the goiter looks like. I think they took someone's image, and it is here. The goiter is here. You can see it in the image number. The sample is what? B. The one below B. You can see how it looks. All the different angles for that particular goiter. So this image is of an 82-year-old man with a palpable right thyroid mass. Cross-sectional imaging revealed a heterogeneous bilateral massive non-toxic multinodular goiter with a retrosternal left thyroid lobe. And on E, which is C and D, then E, note that the retrosternal component is below the arc of the aorta and has grown along the vertebral fascia, which is in image F. The right upper pole has displaced the course of the right common carotid artery. This patient required manubriotomy to deliver the mediastinal component of the gland safely. So this is for you. There is an evaluation. There is also actually here, they are still showing you more images of the goiter and how they worked on it. Indications for treatment. Non-toxic goiter that causes local discomfort such as tightness or choking sensation, especially with certain movements, or that has caused mechanical partial obstruction of the upper aerodigestive tree should be considered for treatment. Treatment modalities are also here. Yeah, so this is an article that is from a book. It's like a chapter that you can use. The book is called Current Surgical Therapy, 14th edition by John L. Cameron and Andrew M. Cameron. So colleagues, This is a clinical key for you. I don't want actually to go further about it. You've seen it, you know that you can use it, and you have access to it. They also on the platform give you new updates, so content updates, summer 2025, new books added in May, new books added in April, other updates, clinical AI, start your free trial today in case you want, and then Gen AI academic for health. Trending topics, clinical key quick app sheet, clinical key adoption kit, training calendar, measles, clinical rounds, a new section to the Lancet's clinical content. So this is the information that we have for you today. I thank you for listening to me. If you have a question, I'm here to answer. It could be related to this resource or any other library-related question. Thank you so much. You can raise your hand. You can type in the chat. I'll be here to respond. Thank you. It's your time, guys, now. Talk to me.
I have a
Yes, please.
I don't know if it's this one. I was trying to navigate. No, I don't know if it was clinical key, but it's as if it had videos. I don't know if I'm mistaking it for some.
There is also clinical key student. Let's try to see it. Clinical key. Nursing student. Clinical key, student nursing, which is this. Let me try to go to it. So which kind of videos were you interested in that you saw in the platform? Then I can quickly actually maybe get to know which one it is. If you can try to explain it further.
I'm not so sure if it was
So
this. I'm just trying to remember. I was trying to NG tube insertion. Just
okay. I think clinical key student nursing has some videos in it from what I saw. But I doubt that this one has videos, but we can also check. This one has videos. I think this is the one you are checking. Here they don't show that they have any videos, but in this one, sometimes you might think they are the same. They are different. So this one, even the book was also added here, medical surgical nursing, one we've been looking at. So the videos are here in the clinical student nursing. So they are here, introduction to genetics, the lymphatic system, calculation, and the blood, digestive system. Let me try to play one of those videos.
Okay.
I think the video is still loading. Oh, sorry. Can you hear the video play, the sound?
Yes, we can.
Yes.
This video will cover the digestive system. The 3 key learning points will involve the structure of the alimentary canal, the journey through the alimentary canal, and finally the accessory organs of digestion. Our body needs nutrients from food to maintain energy. Essential processes such as growth and repair can only be sustained through digestion. The digestive process gradually breaks down ingested food into smaller building blocks such as amino acids, mineral salts, fats, and vitamins. These can then be easily absorbed into the blood before being transported to cells throughout the body. Digestion is essentially a journey through one long tube known as the alimentary canal, or the gastrointestinal tract. The activities of the digestive system can be grouped under 5 main steps. Ingestion, the taking of food into the alimentary canal, in other words eating and drinking. Propulsion, the action of mixing the contents and keeping everything moving steadily along the alimentary canal. Digestion, the mechanical and chemical breakdown of food. Absorption, the central process in which the products of digestion pass through the walls of some organs of the alimentary canal for circulation and use by body cells. And elimination, the food that cannot be digested and absorbed is excreted from the alimentary canal as feces by the process of defecation. The alimentary canal is essentially one long tube. In adults, this long tube is approximately 5 meters long. The alimentary canal consists of the mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum,
Josephine,
and anal canal.
we use
We will first look at the structures of the walls of the alimentary canal.
credentials. And
let's take a look at the large intestine as an example.
Open Athens, okay?
Here,
That's the
we
platform
see
we are
that the
supposed to
alimentary
use.
canal is formed by 4
Then someone
different
saying,
layers of tissue.
remind me of the
outer layer is called the serosa,
research
which acts as a
of
physical
other
barrier. Think of the serosa as a sac
not
that contains a
into the
small amount
corpus.
of serous fluid.
Then another
Next
is like,
are 2
if I
layers of
wanted to
smooth
study
muscle.
about
The
something
muscle
else,
fibers of the outer layer
would
are
be related
arranged
to medical or
longitudinally,
not.
and those of the inner layer are
Okay,
circular.
that was NASA. So
The muscular layer supports the gentle
okay, the
contraction and
resources are there.
relaxation of the alimentary canal.
I can take you back
This
to
type
our
of
page
contraction
here,
is called peristalsis and is under the
and
influence
you
of the
can, for
sympathetic
now,
and parasympathetic
you can
nervous
use
system.
this page.
This gentle rocking
Open
sensation
Athens,
generated by muscle
this one.
contraction mixes the food with the
Access
important digestive
Open
juices
Athens,
and
then you can
propels the
search.
food
You
through
can
the
search, make
alimentary
a search
canal.
on anything else that you want. It will bring you
Next is the submucosal layer,
results.
consisting of connective tissue with some
in your
elastic
course.
fibers.
And if you're not,
Finally, the innermost
you can
layer
also
is
let me
known
know
as the
exactly what
mucosa
you
or
mean.
mucosal lining. This
Remind me
layer
of
is
the
important for
resource
protection,
we can
secretion,
use
and
for
absorption.
research of other researches, even those not related to the course. So yeah, so
Now
here,
that we have examined the tube, we can
let me
follow the
actually pause
journey
this
through the
video
alimentary canal as food enters the body via the
so that
mouth.
we can, which username are we using? Mine is failing, Open Athens. So now you are using your AKU email address and then the same password that you are using with that email. For example, when you're looking into Moodle, the credentials you use will be the same credentials you are required to use here. Sisi, are we together? Also tell me which resource you are using that is failing, maybe. Then we can test it together here. We see what is going on. It will be great. Thank you too, Sisi. So yes, I paused the video so that we
Oral
could
cavity. The oral cavity
look
is
at
lined
other
with mucous
things, but
membranes,
yes,
as it is important.
the videos are here. Whoever was asking about them, so you can find them in ClinicalKey Student Nursing. And you have access to it. You just log in with our Open Athens credentials, and you'll be able to watch all these videos. Are we together now, colleagues?
Yes, we are.
Yes, so ask me more questions before our time elapses. Do you have any more questions? I think even here we have a book, this one, the Medical Surgical Nursing book. I think we also had it in ClinicalKey Nursing. So let's open the book and see. Yeah, it has chapters here. You can just pick a chapter. Good evening.
Does this is Leonard. I wanted to understand, does this ClinicalKey license also work for other Elsevier products, so it's only the ClinicalKey?
Does the Open Athens?
Yes, the Open Athens. Does it work for also like the 3D anatomy application from Elsevier? Does it also work with the credentials of this ClinicalKey?
No, they don't work because we have not paid for that resource. Whichever Elsevier resource we have paid for, it works. But those we have not paid for, it doesn't. And you see in our list, those resources are there. So you cannot go and use it there and it works. It will not work. They will reject you.
Okay. Thank you.
Yes, use it only for those ones we have paid for. And the ones we have paid for, we always list them so that you can know them. So we have paid for, and Elsevier have paid for a resource called Osmosis. After Osmosis, we have paid for ClinicalKey. Then we have also paid for ClinicalKey Student Nursing. We have paid for a resource which is called, is that one that we use to do our literature searches. It's called Scopus and others from Elsevier. So those are the ones that you can use your Open Athens with. And some actually will not accept Open Athens. Like I know Scopus will not. It will ask you for the email directly and then sends you one-time link and you join. there will not be any need for you to use Open Athens. I'm sorry, Josephine answers that yours has failed to open, but this is what you are supposed to do. Possibly you are putting credentials somewhere else, and I know you can't share your screen for me to see what's going on, but it will work. Don't keep attempting. Just don't attempt. Pause for now. When you get more time, you can redo the search. Okay. Yeah. For now, pause. Otherwise, you might get discouraged. It will work. So long as you see where the word Open Athens is, or you can take me through what you are seeing on the screen and we move together. I guide you what to do. I can give you some 2 minutes and we sort that one. Hello. Actually, if you can unmute, I think we will serve you better. Will you try to unmute and talk? Okay. Try to unmute, talk, then I guide you through. My phone. Oh, okay. Okay. We can also try when you are not using a phone, when you're using a laptop. Sometimes the phone has some features that can't work. Okay, I think I've gone off. Am I still on? Can you hear me?
Yeah, we can.
Okay. Try when you're not using a phone, try to use a laptop, something which is like web-based, so that you can get a better experience. Sometimes phones they have some limited features for some things, so don't over rely on a phone. So if you're using laptop login, guide me. What are you seeing on your screen? Which platform and what are you seeing on your screen? Then I guide you. I'm waiting. Which ClinicalKey? The ClinicalKey nursing, this one. So let me log out so that we move together. If you can see my screen. So I have logged out. So what would you do? You click on login. You see where the word login is? I don't know whether my screen is covered for you guys, but it might look like. So on your top right, look at the word login. Don't click on register. So when you click on the word login, it will give you that interface like it has given me. Oh, it is covered. How about now?
Covered.
It is still covered. Hello?
It's now clear.
Okay, it's clear. So when you look at this screen, there is username, there is password. Please don't put anything there because you don't have an account with them. Just look on your right where you see the words login via your institution. There's also login. There's also other institution login. For us, the word Open Athens is already shown somewhere. We don't have to go anywhere else. You simply click it like that. When when it appears, it should take you to the portal for Open Athens, and you put in the password and email of Aga Khan. I hope it doesn't log me in automatically because I want you to see what happens. I hope it doesn't log me in automatically, but it may because it already had logged me before in, so it might remember. But for your case, it is going to give you a window which asks you for two things: email and password for Aga Khan. Now, when it finishes authenticating, it will ask you these questions. I'm going to pick Uganda because this is where I am, and I say continue. Then it will log me in automatically. You can see at the top my name is showing, and I can also have some settings to set. There's also this one, which is for if I want to email them or ask for some help. There's also more information here, if you can see. I can call them, I can log out, I can do remote access, I can change organization, look at presentations. Actually, I never picked that. So I have not made any presentations, so they will not be here. Just for your case. So if you're still failing to log you in, Just hold on. You can get another day, another time, and you try to log in. It should work. I don't know what's wrong right now, but don't force yourself. So, guys, thank you for listening to me. Yes, I can see something in the chat. Let me check it. Yeah, you are saying okay, that's okay. So allow me to end the session here, but if someone has a question, I can still take it before we go to have our nights. Thank you, Fakato. You're welcome, Josephine. Wanje. Okay, someone may be admitted by mistake. So let me end the session here and now. We will.
Hello,
I'm saying,
faculty. Good evening.
good evening, guys. Have a wonderful night.
I was asking if, in case I look for journals, can I get where to cite from, like the site where I can pick the citation from?
Yeah, depends on the
From
platform
this
you are
resource.
on. This one.
Yes.
Clinical key student, these are guidelines, they are not journals for clinical key.
I read somewhere where there are journals.
Okay, if they're journals here, let me just take you there.
They have different parts. Journals.
Yeah, let's go to them and see. But this is a current platform, so yes, citation should be easier. So let me check this one, what it has. Yeah, you can. Because now this is the journal. Let me just open like volume 167 of it, the one of August, and see how it displays. So let's say you've taken this article and it's the one that you want to use. So let's open it. No, it does not have that feature like already embedded in automatically. So you'll have to use your citation skills that you've been taught in class to cite this. But I also believe that if you put this one in Google Scholar will pick it. Let me just show you. Just a moment. Let's go to Google Scholar. You
We
put
can't
it.
see the screen.
Oh, you can't.
Yes.
Sorry. So I had looked at one of the results here that we had here. It was this one. The way they have made it, they don't give you that feature for citation to see it quickly. So I copied the title here from here, and I'm going to paste it into my Google Scholar. Okay. We are together now.
Yes, we are.
Oops. So I'm going to paste that title here and then make a search. So it has come. This is it. And even this one, I think it was this, it had what? Internet gaming disorder in children and adolescents, a systemic review. This one was a systemic what? So the second one, this is familial, protective, and risk factors. So which one has familial? It is this first one. So the citation is here. Are you able to see it? Here. I can even add it to my EndNote. Are we together now? For the person who asked the question. So long as it is a journal and you can reach the article, you can always put this one inside in his Google Scholar and then you can get the citation. So it is here, the one for APA. Well cited. Are we now together? I don't hear a response, but I believe we are together.
We are.
Thank you, guys. So I would like to wish you a good night now. And keep your questions coming in case you have them. We'll be able to respond. Bye.
Bye.